Secure 65 health plans where seniors thrive.
Confusion is costing seniors thousands. Let's expose the truth right now. Watch Secure 65 Health Plans.
One bad Medicare decision can cost you thousands, but one conversation can save you. Watch now, here at Secure 65 Health Plans.
Secure 65 Health Plans.
Austin, your cartoon made my grandma super happy. Thanks for making her smile. It's always amazing to see my grandpa laugh, and that is because of your cartoon, Austin. Thank you.
Welcome to Austin's Cartoons, making Medicare and insurance simple, one fun story at a time. Let's bring on the laughter.
Secure 65 health plans where seniors thrive.
Secure 65 Health Plans podcast. Medicare madness. Who really has to pay? And who's been wasting money? Welcome back, everyone. Oh, I love to see my fabulous Secure 65 family. It's your girl, Monet Swan, your Medicare interpreter, your Social Security translator, and your advocate who keeps you out of financial trouble. Today's topic, Medicare. Who actually needs to pay, you guys, and who's been donating money to the government for no reason whatsoever? Now, here's the spoiler alert. A lot of people are paying for Medicare when they don't need to, don't have to, or really shouldn't. So let's fix that today. Go grab some water, grab your notepad, grab your blood pressure cuff, because this is about to be a volatile ride. Segment 1, it depends. The government's favorite phrase. So let me start with a phrase I promise you've heard before. It depends. Whenever you ask the government a straight question, should I pay this? Do I qualify? Is this mandatory? They hit you with the most non-committal, unhelpful sentence in the English language. Well, it depends. And guess what? They're not lying, because with Medicare, it actually does depend on your age, your income, your work status, your disability status, your coverage, your birthday, and whether the moon was in retrograde or not when you turned 65. So we're breaking all of that down today. There will be no more confusion. And we will not let anyone else's confusion confuse you on these topics. Segment 2. Who gets Medicare and when? So you guys, you get Medicare when you turn 65 or you've been on SSDI, which is Social Security Disability Insurance, for 24 months, okay? Now that's not to be confused with SSI. Let me say that loud for those of you in the back. SSI does not give you Medicare. SSI is a welfare program. SSDI is disability insurance you paid into. So different programs, different rules, different drama. So if you're on SSDI, yes, you get Medicare. If you're on SSI, no ma'am, no sir, until 65. Segment 3, let's break down the parts. Medicare is like a bad breakup. It's messy, expensive, and full of parts. Part A, hospitalization, usually zero premium, not free. You already paid for it with your FICA taxes. It covers inpatient hospital stays. And yes, you must accept it at 65 if you're already getting Social Security, unless you don't get it free. Then you can decline it. Otherwise, welcome to Team Part A. Part B, doctors and outpatient. Now, this is one that costs $185 right now, but next year, 2026, it will be $202.90. Now, this is the one people panic about. This is the one you can decline, but only if you have credible coverage. We'll get into that in just a minute. Now, Part C, which is Medicare Advantage. God bless it. I don't like calling it Part C. It sounds like it's part of original Medicare, and it is not. So cut the confusion there, okay? It is a private insurance company offering Medicare coverage, okay? And we'll talk about why that matters a little later as well. Part D is prescription drugs, okay? This is run by insurance companies and full of penalties, you guys, if you get it wrong, okay? If you miss enrolling in Part B or D, the government doesn't cry. No. They penalize you for the rest of your natural born life. All smiles. Segment 4, penalties, the government's favorite side hustle. Okay, you guys, so let's talk penalties. Part B penalty. If you miss your window and don't have credible coverage, you pay 10% extra for every 12 months you missed. What does that mean? For the rest of your life. You miss 10 years, that's 100% penalty. So now you're paying double for Part B every month from now until the Lord calls you home. Part D. Now here's the Part D penalty. 1% per month of the national average cost of a Part D plan. Also a lifetime penalty. Part D is like an elephant when it comes to forgetting. Elephants don't forget, and neither do penalties. Segment 5, when you don't have to sign up for Part B. Now, this is where most people who have not enrolled in open enrollment by now get nervous and question if they're doing the right thing. You can decline Part B at 65 only if you have credible coverage from current work, from you or your spouse, or your employer has 20 plus employees. And that's it, okay? That's the only way out without a penalty. So what is not credible coverage? Okay, write this down, you guys. VA coverage. TRICARE for Part B, you still need Part B. Marketplace or Obamacare plans. Nope, don't qualify. COBRA? Nope. Retiree plans? Nope. Your cousin's little insurance card he printed at Walgreens? No. If you stay on a marketplace plan past 65, no. Plus, you lose your subsidies, you guys. The cost goes up. And Medicare is much cheaper than the marketplace, okay? So the math is ridiculous if you're trying to stay on the marketplace after 65. Don't even give it another thought. Segment 6, special enrollment period. Now, your penalty-free escape hatch when you leave employer coverage is this. You get an 8-month special enrollment period to start Part B without penalties. So should you wait 8 months? No, absolutely not. Do not wait 8 months. Why? Because I'll wait is and always will be your famous last words. 2 or 3 months before your job coverage ends, I want you to fill out forms CMS-40B and CMS L564. Have your employer confirm your coverage, then submit them to Social Security. What will this do? Well, this will avoid penalties and unnecessary drama. If you worked multiple jobs after 65, well, you're going to also need multiple forms to prove continuous coverage. And what happens if you miss a gap? Well, hello, penalties. The government does not play connect the dots for you, okay? They will happily penalize you for a job you forgot you had in 2018. So keep that in mind. Segment 7, veterans. PSA for my VA folks. My veterans, listen closely. I love you. I honor you. But the VA is not credible coverage for avoiding Part B. You can choose not to take Part B. Nobody will arrest you. But if 3 years from now, the VA clinic closes or reduces services, or you want a second opinion, or you move, or you get sick, or politics shift, yes, you too will pay the 10% per year penalty. So what's my advice? Don't gamble with your health in America, okay? Don't do that. It's like the old commercial. It's not nice to play with Mother Nature. And the government can be not so nice too. Segment 8, living abroad, the expat myth. So now if you're retired overseas, you can skip Part B. But when you come back, oh yes, there will be a penalty. Unless you lived in a country with a national health system that Medicare recognizes as credible coverage. Some do, most do not. So what do? You check with the U.S. Embassy or consulate before you assume anything. Because as you guys know, assuming is expensive. Segment 9, what if you can't afford Part B? Now let's talk reality. Some people want Part B. Some people need Part B. Some people simply can't afford Part B. Enter Medicare savings programs through Medicaid. Okay, now there are 4 levels. Okay, you guys, 4 levels to it. There's QMB, there's SLMB, there's QI, and there's QDWI. So now if you qualify for any of those things, the state pays your Part B premium and sometimes even your Part D. Now, I'm going to tell you, it's not easy to apply for, especially now that funding is being slashed, but it's worth trying, right? Doesn't hurt. The Inflation Reduction Act tried to simplify the enrollment, but the new administration delayed that by 10 years. So expect long waits, paperwork, mazes, and a lot of nonsense. But apply anyway. Nothing beats a failure but a try, so do it. Segment 10, the Part B give back. The famous Medicare Advantage give back, AKA the plan they used to tempt you like free samples at Costco. You remember those? I think they're still there. Well, this is not free money. This is not a refund. This is not the government being generous. No, this is your Medicare Advantage plan saying, we'll pay part of your Part B premium if you join our plan, because we will make the money on the back end, right? So you say, well, Monet, how does that work? Come on now. If the plan pays 50, 100, or even 185, trust and believe, you guys, they will get their money back somewhere else. It'll be through the hospital cost or co-pays or out-of-network charges or prior authorizations, et cetera, et cetera, et cetera. It works great for some people. You don't get sick, it works great. It is a disaster for others. It depends on your doctors, your health needs, your zip code. Don't forget your zip code, medications, access to hospitals, and your ability to fight for prior authorizations. So you must evaluate this every single year. But please don't leave it up to chance, okay? Okay, everybody pause, exhale, inhale, exhale. Okay, I'm going to pause here for a minute. Do you guys like this information? Let me know. Put it in the description box. Put it in the box below. Does this make sense? Because if it does, let's talk. Let's talk about how you can become part of our community. We have the community side of the insurance side and the financial side. We even help you with a career if you are looking for one. All three parts are needed for a successful and stress-free senior life. And then we have the cherry on the top with programs that offer, you ready? Transportation, health and dietary support, extra activities like martial arts, art, dancing, singing, and financial literacy, parties, and a lot of fun across the country. So listen up. Socialization is the key in your later years. So don't try to go this life alone. Would you like to meet some good people? People you can trust that aren't AI and talk to just about anything? Join our community and get engaged. Call Collaborative Expansion Foundation. The number's below. And you know what? You can become a donor or a volunteer or a member. We love our members and we are here to help you. Play the song Net CEF, bringing people to life with love and knowledge.
CF, bringing people to truth through love and knowledge. CF, bringing people to truth through love and knowledge.
And now, part 2. So next, you guys, we're going to be covering IRMAA, Disabled Adult Children, also known as DAC, group homes, dual eligibility, Medicaid plus Medicare interactions, PPO and HMOs, Medicare Advantage pitfalls, annual enrollment traps, how to avoid billing nightmares, and we're going to wrap all this up with a call to action. Sounds fun? Good. Let's keep going. Segment 11, IRMAA, when Medicare decides you're rich. All right, let's talk about my favorite little surprise letter, IRMAA, the income-related monthly adjustment amount. Now, IRMAA is when Medicare looks at your tax return from two years ago and says, oh, you made some money. Cute. Pay extra. If your income was high 2 years ago, maybe from working or selling a house or cashing out a big retirement account, oh, they tack on an extra surcharge to your Part B, Part D. Part B and Part D. So now your Part B isn't just $185. Oh, no. Now you're paying $185 plus that IRMAA charge, which could be an extra $100, $200, or $300 more per month. But here's the good news. IRMAA, unlike everything else, is not forever. It's based on that one tax year. And they recheck every year. And if your income dropped, completely dropped since then, because let's say you retired or you got divorced or lost a spouse or lost a job or reduced your hours or had a big one-time sale, you can fight back. Okay, there's a form called, write it down, SSA-44, where you basically tell Social Security, listen, that high income life was 2 years ago. 2 years ago, that person no longer lives here. Please adjust this bill, okay? And if it's a legit life-changing event, they can reduce or remove IRMAA going forward. So if you get that surprise letter, don't just sit there and cry over your coffee. Appeal it and call us and we'll show you how to do it successfully. Segment 12, Disabled Adult Children, DAC. When a child gets benefits on your record. Okay, you guys, now let's get into something that confuses almost everybody. Disabled Adult Child Benefits, often called DAC benefits. Now, this is when an adult child has a disability that it had to begin before age 22, okay? And a parent is retired, disabled, or deceased. Now, that child can sometimes get a check based on the parent's work record, not their own, okay? Because there's probably not going to be one. So it's not based on them. It's based on the parent. So you'll see situations like dad retires and starts Social Security. Child, now an adult with a disability, starts getting SSDI as a disabled adult child on dad's record. After 24 months of SSDI, the child becomes eligible for Medicare. Now we have a disability check, Medicare entitlement, and often Medicaid or state medical, like Medi-Cal here in California, paying as secondary, okay, the secondary position. This is what we call dual eligibles, having Medicare and Medicaid. That's dual eligibles, okay? Now stay with me because this is where it gets a little tricky. Segment 13, dual eligible and group homes. Don't break what's working. Okay, you guys, so let's say you have a disabled adult child living in a group home or on SSDI, which is DAC, right? Disabled adult children, getting Medicare after two years. Already on Medicaid, Medi-Cal, whatever it's called in your state, okay? In that situation, the goal is do not break what is already working, okay? Let me give you some basics. Number one, yes, they can have Medicare and Medicaid. That's actually ideal, okay? Medicare pays first, Medicaid covers what's left, depending on the state and the level. Number two, if they qualify at a higher Medicaid level, the state can pay their Part B through a Medicare Savings Program, MSP. Now remember, this is what I shared with you earlier with the QMBs, the SLMB, and the QI, and et cetera. Okay, so keep that in mind. Number three, where people blow it is listening to the wrong person, is when they get talked into a Medicare Advantage plan without checking, okay? What do you need to find out? Well, first, does the group home work well with that Medicare Advantage plan, okay? Are the doctors and the facilities he or she sees in network? Super important. Next, will the staff cooperate with the plan's prior authorization? Okay, because here's the truth. Group homes and facilities often prefer straight Medicare plus Medicaid because it's easier to bill and more predictable. Okay, so if you're caring for a disabled adult child in a group home and someone Some agent says, oh, hey, we can get your son an extra $100 or $200 in grocery and an OTC, which means over-the-counter drugs, fancy name, OTC. You better pause, okay? Put them on hold and say, okay, but is it going to cause a problem with his group home, his services, or providers? Got to ask them that, because sometimes that $100 bonus costs you in disrupted care, confusion, and bureaucratic chaos. Simply is not worth it. So what's the bottom line? When someone is stable in a group home with Medicare and Medicaid, you do not chase every shiny new plan without 1, talking to the group home administrator, 2, the social worker, 3, the preferable and trusted unbiased Medicare guide who understands dual eligibles. Then you're safe to move forward. Segment 14, PPO versus HMO. Rural folks are getting squeezed. Okay, let's talk alphabet soup. HMO versus PPO. HMO is a health maintenance organization. Okay, they're smaller networks. You usually need referrals. They are cheaper for the insurance company. They are more managed and more controlled. Okay, so they're fabulous. Great if you live in an area with lots of doctors, big health systems, and you're okay funneling everything through your primary doctor. Your second option is the PPO, which is a preferred provider organization. What does it offer? More freedom. You can see more doctors and specialists, especially helpful if you're in a rural area. However, they are more expensive for insurers, or AKA insurance companies. What are many companies doing right now? Let me just tell you, many companies are just cutting back on the PPOs, or quietly changing them, or just simply dropping them altogether. So what happens? Well, people in small towns, rural areas, or places with limited specialists are feeling the hit the most. Why? Because there are fewer plans. There's smaller networks. People that are having them have to jump through more hoops and probably drive a little bit longer. So the moral of the story is, if you live outside a metro area, you have to pay attention to what kind of plan you're in. The difference between an HMO versus a PPO can literally be the difference between seeing a nearby doctor, or you could be driving up to 2 or 3 hours away for care. Segment 15, dental, vision, and hearing, the big Medicare gap. Now let me say something that makes me instantly annoyed every time. Original Medicare does not cover routine dental, routine vision, or hearing aids. Does that make sense in a country full of seniors with dental problems, glaucoma, cataracts, macular issues, hearing loss, and isolation? No, but traditional Medicare does not cover it. But here we are, okay? And Medicare Advantage plans know this, and they dangle this little carrot of free dental, ding, 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 free vision, ding, 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 free hearing. Listen, there's nothing free. They're using your tax dollars, FICA dollars, and federal subsidies to put sparkles on a plan that still has a lot of fine print. Standalone dental insurance is definitely worth it. Best thing to do, though, is to find a plan with a large network and call us and we'll find out. We'll see if your actual dentist is already a part of one of our carriers or networks. So you have to ask yourself, well, do I even need dental insurance? And if so, which plans do you take? Because if you don't have us helping you with this dilemma, and you purchase a dental plan that your dentist doesn't take, Well, that's like having a bus pass in a city with no buses. Think about it and give us a call. Segment 16, why you must review your plan every single year. Now, here's one of the biggest traps I hear every year from a senior. I've had the same Medicare Advantage plan for years. No, you haven't. No, you haven't. You've had the same card and you've had the same logo. And I'll even go to say maybe the same company name, but they can change. You're like, well, no, they don't. Like, how, Monet? How can they change? Copays, deductibles, max out-of-pocket hospital costs, specialist costs, drug tiers, networks. Oh my gosh, it goes on and on and on. Every single year, those things do change. So last year, your hospital might have cost $100 a night. This year, it could cost $300 a night. Your MRI might have been $50 last year. This year, it might be $300, okay? And they're not required. The carriers or companies are not required to say, hey, Melanie, hey, Sam, your benefits are worse. Just wanted to let you know. Come on, you guys. This is a business for them. They send you a thick booklet most people never read called the ANOC, your annual notice of change, and keep it pushing. Okay, they don't make any more calls to you. That's why from October 15th to December 7th, just around the corner, you must review your plan. This is what you should be looking for. Okay, so get out a pencil, piece of paper. Let's do this again. Number 1, are my doctors still in network? Number 2, did my copays change? Number 3, is my hospital still covered the same way? Number 4, are my medications still on the same tier? Number 5, is my maximum out-of-pocket still something I can survive? Because if you have a Medicare Advantage plan and you don't review it every year, you guys, you're playing financial dodgeball with your health and with your money. Segment 17, 2 missions in retirement. Whew, okay, let me leave you with this. We've gotten through a lot of information, but in retirement, you really have 2 main missions. Get back everything you paid into all of those years for Social Security taxes, Medicare taxes, premiums, deductibles, okay? Your goal now is to collect every benefit you're entitled to. That's going to include Medicare, supplemental coverage where appropriate, Medicare savings programs if you qualify, extra help for prescriptions if you qualify, dental, vision, and hearing if accessible. This is not a charity. Insurance is not playing. This is your money coming home, so go get it. And this is why we're here, so that you don't get taken advantage of. You are not just a consumer now, okay? You're a community elder with receipts. So grab that phone, call your friend at church, your neighbor, your sister or your brother, your cousins, and even that one uncle who doesn't like doctors but still has 3 specialists. Call them and say, hey, have you looked at your Medicare lately? Do you know if you're paying for Part B when the state could be helping? You can kind of play the role, right? Do you know what your out-of-pocket max is? Do you know where your Advantage plan changes have occurred for next year? Listen, you guys, half the battle is just knowing what questions to ask. So call us. We're here for you. Segment 18, call to action and closing. Okay, you guys, we are at the end of the podcast and almost the end of open enrollment. December 7th is just, again, around the corner. So here's what I want you to do after this episode. Okay, number 1, log into ssa.gov and medicare.gov. Confirm your Part A and your Part B status, and check if you've got any IRMAA letters, any upcoming changes, or just simply weird notices. Number 2, if you're low income or struggling to pay Part B, call your state Medicaid office today. Ask about Medicare savings programs and ask specifically, do I qualify for QMB, SLMB, QI, or help with my Part B premium? Number 3, if you're on Medicare Advantage plan, ask yourself, do I still like this plan? Did I even take out the time to compare it to anything else? Do I know what really happens if I get really sick or need a big expensive surgery? Number 4, if you're a caregiver for a disabled adult child or a loved one in a group home or on Medicaid, before changing anything, talk to the facility. Important. Talk to a knowledgeable agent or counselor, even if it is not us. Ask what works best with their setup. Because you guys, one wrong choice in Medicare can cost you thousands. But one right choice can protect your health, your dignity, and your wallet. So you guys, you've been listening to Secure 65 Health Plans for a while, and this is where we do not accept confusion as a lifestyle. So I'm Monet Swan, your Medicare translator, your Social Security hype woman, and your reminder that nothing, and I mean nothing in this system, is simple. But with the right information, it is survivable. And if you do more than just listen and use it, you will be thrivable. If this episode helps you, subscribe, like, and share it with as many people as you know who may be confused, stubborn, or simply all of the above. That's how we change outcomes, one conversation or one podcast at a time. So until next time, you guys, take your meds, check your mail, read your statements, read your ANOC, and remember, you are not a burden to anyone. You are the reason these programs exist. I love you guys, and as always, stay golden. Bye.
Secure 65 class planes, we're singing fly. Secure 65 health plans where seniors thrive. 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 Secure 65 health plans where seniors thrive.
Vivex Wealth Insurance Solutions.